I'm Brother Sebastian Otengelo. I belong to the Brothers of St. Joseph. I'm a nurse in profession. I work here in Tangulbei. I do nursing services in the facility. At the same time, I'm given a role as in charge. My role as in charge is to link out the staff with administration and also the MOH staff who come to supervise the facility. I link with them to the facility. I joined this place 2013. So when I came here, mainly we are doing what we call the primary health care. The services actually we offer, most of them are promotive, preventive, and then curative. So in promotive services is we teach, promote health living. We encourage the mothers to take care of the hygiene. We encourage them to bring children for immunization and encourage them to bring also mothers who are expecting to deliver in the hospital. That is in promotive. In preventive, we do immunization to prevent the communicable diseases. And then in curative, when things have reached there, we treat those who are sick. When you look at what they call the TDMP, what stands for Tangulbei Division Medical Program, initially it was covering the division area. But this time now we are covering a bigger part of, I can even say the whole of this sub-county region of the East, because that is our coverage area. Many clients come from very far to come to this facility. So we have gone beyond the division as it was before.
Kurana Chepchepunye Longronya. Kwa majina naitwa Chepchepunye Longronya na mimi natoka Katungura. Nilienda kujifungulia hospitali ya Tangulbei Catholic Mission. Na venye nilienda huko, niliona umuhimu wa hospitali. Nilipata madaktari wazuri wenye walinishughulikia. Hadi nikajifungua vizuri kwa hospitali na nikakuja nyumbani, nikaanzisha mtoto wangu clinic hapa Katungura dispensary. Na mtoto wangu ameendelea vizuri na clinic hadi amemaliza saa miezi 9.
Naitwa Susan Joseph, natoka Nachuru. Umbali wa huko ni kilomita 16 mpaka hapa. Huduma ya hii hospitali ni tofauti na zile zingine. Kwa maana ukienda zile na unataka kujifungua, madaktari hawezi kuamka na kukuja kukuangalia. Sasa sisi tunaendanga ile ya Katoliki ya huko, wanahudumianga watu vizuri, hiyo ndio tunakumbuka tu. Hata ukigonjeka tu hivi itakubidi utafute pikipiki na ukuje mpaka hapa kwa sababu ya huduma mzuri.
Mimi nilijifungulia mtoto wangu mmoja hapo hospitali. Na niliona manufaa mingi sana kujifungulia hospitali kwa sababu niliweza kupewa dawa ya uchungu na nikaweza kupona. Na nikaanzisha mtoto wangu clinic. Na ningependa kuwahimiza wamama wa huku na Saltuko walete watoto clinic. Pia ningependa kuomba muweze kuleta daktari mwenye anakaanga hapa kila siku kwa sababu mwenye anakuja kila Alhamisi anakuja tu hiyo siku ya Alhamisi, lakini hizi siku zingine tunaweza kuwa na wagonjwa tunawapeleka Tangulbei. Huko ni mbali, mtu anaweza zalia hata njiani, arudishwe tena nyumbani. Na ningependa kuwashukuru sana na ningeomba pia muweze kutujengea shule kwa sababu hao watoto wenye wanazaliwa ni wadogo, hawawezi enda shule za mbali. Sasa mkitufungulia shule hao watoto wote tutawaweka shule.
We have about 8 health posts. We have Sosion, we have Kalavata, we have Chepkalacha, we have Nasaltuko, we have Orus, we have Lotita. In every month, we conduct 2 outreaches, every month, so it covers 8. These people, they stay very far. So we wanted to take the services more closer to them by erecting health posts.
Primarily, Catholic Church has been complementing government work. They have programs that target solving problems of the people directly. And here we also have a hospital at Tangulbei, which I've visited, and I want to say they are offering a very good service. The environment is good. I've always found people there, and the church leadership is also good, because I know the church is the one directly dealing with the management. Hospitals or health centers are very far away, like in Tangulbei, which is the headquarters. Apart from the Catholic hospital and the sub-county hospital, all the other health centers are very far away.
The data I have is from 2015. Mothers who are coming for the clinic, our coverage in 2015, it is 557. 2020, it is 1,623. So you can see that the figures is actually growing. The mothers who come for immunization, the number is also big. In 2015, we had 1,614. Then in 2016, we had 880. 2017, 2,426. 2018, 2,841. It shows that it's expanding as we grow. Deliveries. In 2015, we had 33. 2017, we had 87. 2018, 179. 2019, 131. 2021, we had 317. The county, they also give us the population coverage. When you look at that figure, you'll see that what they give us, we succeed by a half.
When you talk of universal health care, we want to reach as many people as possible. That's the intention of government, because that access has been lacking. Even here, when you have the hospital, there are still places that cannot access this hospital. When you talk of access and somebody cannot reach you, you go out to reach them. One thing that I'm happy about the hospital is because they normally have outreach programs where they go out to the people, the management of the hospital, to make sure that they make arrangements for ambulance services. So that idea of outreach, they are complementing our work of achieving universal health coverage.
Tangu taasisi ya Catholic kuanza katika hii area, tuliona mabadiliko ambayo ni mabadiliko mazuri. Mortality rate ikaenda chini kwa sababu dawa siko karibu. Services ya hospitali katusaidia kabisa. Kwanza mambo ya gari, tukipiga simu wanaharakisha, wanakimbiza ambulance, wanakuja kutoa wagonjwa na wanaenda kutibu na wanapona.
My name is Kopon Ripo from Katungura. The Holy Ghost Fathers has helped us in the construction of this dispensary. This institution has really helped the community, especially the children and the expectant mothers. Every Wednesday, they come here for the clinics. Our only request is that the Holy Ghost Fathers should get us a residing doctor who will stay here permanently, so that they can attend to the sick on a daily basis, because one can become sick at any time and is not able to wait for Wednesdays for the clinics.
One of the challenges is the road network. The roads are very, very poor.
Barabara ni mbaya sana, kwanza kuanzia hapo na Sartuka hapo pale hiyo hospitali iko ni mbaya sana. Ikinyesha sasa, hata mtu angepata hata nafasi ya kuja upande huu, ungegonjeka tu kwa nyumbani na hakuna usaidizi yoyote. Ukikujia pikipiki unakuja na 1,500 mpaka hapa.
The community also vandalizes our facilities. We can put the wire, they cut the wire. So we want to put a staff around those facilities to stay there. In that way, maybe we would prevent that. Another area of challenge is understaffing. We are only 5 qualified staffs. So we'll get that they are overwhelmed. So that is one big challenge. And the final challenge is that the facility is far from self-sustaining. We can say that about 67% of our income is a donor funding. So you can see that what the facility can only be able to raise is only 33%. From the number and the way we see our figures growing up, it means that the facility is highly patronized. Many patients come from very far because of they will get the services here. We are surrounded with government facilities. At one time, they also ran out of drugs. Patients have nowhere. They only come to our facility. When I came, we had only one small room there where we used to dispense and do the delivery. You can see we have expanded. We have added laboratory. We have added the pharmacy. We have now a maternity wing. We are growing. So the theater is on the progress. We are already in level 3. When I came here, it was level 2. Some of our collaborators, one is the Ministry of Health. They give us the record book. They supply us with the immunization, logistics. They come for supervision. Other collaborators are World Vision, Red Cross, the Fred Hollows. They deal with the eye problem. They come because clients makes them come here to look at our data and see how we can be able to help the community to improve in the area.
I'm Masi Cherotich. I work in this clinic as a project officer, and my major role is coordinating activities and also planning activities. I also work in the office of Linda Mama. Linda Mama is a program which the government offered to the mothers, especially antenatal mothers and those who are coming to deliver. They pay for that service so that we can offer the service on free. For NCs, we do it in the clinics and in clinics. Then for deliveries, we do it in the facility. Then we take the claim forms to Cabernet office. Then they later pay for the service. Linda Mama has helped a lot because payment of delivery at first it was a bit difficult, but for now we've experienced increase in deliveries. It is because we do deliveries free and the Linda Mama pays for it.
Usually the patients do not pay as much. They pay what they can, and as with the sickness, you can never send the patient away when he's sick. We'll always treat the patient. So most of the time we have a lot of debt. Patients get treatment, they go away without paying. When Linda Mama came, they pay us $350 for one delivery. So it looked like we have to do so much to get the mothers delivering in the hospital. And that will give us a good package in finance. And see, those mothers who come for the clinic, they pay $500. When we accumulate this amount at the end of the month, it is able to pay at least 2 staffs, and we can be able to purchase for the drugs. The government supports us a lot. They give us some drugs when they are supplying. Of course, not consistent, but they do. Now, that helps us a lot also to take care of our patients. We are understaffed. If the government gave us more staff, we would do much better than what we are doing. The theater is on the progress. I would say 80% is now done. That is in terms of construction. But the equipment, we need a lot of support because otherwise it will just be a structure which is there and it's not doing anything.
Mi kwa upande wangu, nashukuru Mungu kwa hiyo hospitali kabisa. Mungu awatie nguvu na walinde kabisa. Kwa huduma yao ambao wako nayo, Mungu awabariki kabisa. Kwa sababu hii hospitali zote hakuna ambaye itaweza kuhudumia wamama kiasi ya hospitali hii. Na hata jana nilipokuwa mahali hapa wakati nilikuwa najifungua, hakuna wakati daktari aliondoka mahali hapa mpaka wakati nilijifungua. Mungu akanibariki kwa hapa. Hata huyo msichana msungu alikuwa hapa, alinisaidia sana mpaka hata huyu mtoto ni alipatia majina.
We want to appreciate those who have made us reach where we are. As I told you, that 67% is actually depending on the well-wishers. On the ground, the effort that we are doing need also to be complemented. For example, we have talked about equipping the theater. If they help us to equip the theater, that will be a very big step in this community in terms of referrals.